again, this is Dr. Jessica Moran-Hansen, and today we're going to talk about deviated septums. So what is your septum? Your septum is that divider in your nose that separates the right from the left side. Oftentimes people can be born with a deviated septum, or you may have experienced some sort of trauma to the face, sports injury in high school where your septum becomes deviated after that. Some of the most common symptoms of a deviated septum are persistent nasal obstruction, and it can be on both sides. It doesn't just have to be on the side where the deviation occurs. Other complaints patients have, often you get constant postnasal drip, which is just where you have that snot or mucus constantly draining down the back of your throat. Those are the two most common symptoms that people will come in with a deviated septum complaining about. But it is interesting to note that almost 60% of people that have a deviated septum can also have other abnormal findings on their CT scan consistent with chronic sinus inflammation or chronic sinusitis. What does a deviated septum look like on a CT scan? I am going to show you guys a really good picture here. So this is if we're looking at someone from the front, two eyeballs here. The divider right here is the septum. Normally this thing should be going straight up and down. As I go back and forth here, you can note that this patient's poor septum is definitely deviated over to the right, so much so it's starting to impact and block off that side of his nose. Another thing that we note with people that have deviated septums is oftentimes they're turbinates. So these little guys on both sides of the septum are your turbinates. They help to warm and humidify the air. Oftentimes when the septum starts to go over to one side, it allows the turbinate on the opposite side to start growing since there's so much more room on this side. So if you were to take this septum and put it back in the midline for this patient with surgery, at the same time, we also recommend shrinking these turbinates so that you're not blocking off the opposite side of the nose at that time. So surgery is an outpatient procedure, which means you get to come in that day, go home that afternoon. What to expect afterwards? Sometimes people will have these splints in their nose. I know splints always sound scary to patients, but they're these very soft pieces of plastic. They're pretty thin, but oftentimes they have a little tube on the side of them that actually kind of acts as an airway for you, and you put them on both sides of the septum. You do sew them in place so that they can stay there about 5 to 7 days after surgery. Some people take them out even sooner than that, and it kind of helps to hold everything in place during the healing process. Those do get a little crusted over sometimes, so congestion is probably the biggest complaint right after nasal surgery for the septum. But once those splints come out, patients are usually pretty happy, and the increase in airflow in your nose is pretty evident right away after surgery. At the same time, we often shrink those turbinates too. Main side effect from that is a lot of crusting just from the incision and the work we do in the nose, which usually heals up within a few weeks, and people get a very good relief to their nasal obstruction with those two procedures. So sometimes we don't have to use the splints. If you just have like a small area of the septum that's bowing out, it almost looks like a little bony spur. Sometimes we can do a pretty straightforward procedure where we just make a little incision over that spur and remove it. And we can actually just use suture at that time to sew that little incision back down. And oftentimes we don't have to use splints. So it's never a guarantee that you'll have those splints in your nose afterwards.